So my name's Tricia. I'm the office manager for Revive MedSpa. I'm sure I've seen a couple of you here before. And what we're here tonight to discuss is Upneeq, which is a really great product that we just brought on. It's an eye drop to help with your eyelids. So before Dr. Roth comes on, I'm going to kind of walk you through our question and answer. In case you have any questions, you can type them in. So if you use your cursor and you go right to the bottom of your screen, you can see a Q&A box, and that will bring up the question and answer box. You can type your questions in there, and then at the end of the segment, Dr. Roth can answer any questions you might have. All right, so I'm going to introduce Dr. Roth. He works here, eye care specialist with Revive MedSpa. He is an ophthalmologist and oculofacial plastic surgeon. He's been with us a while, and we like him. I guess we'll keep him. And he's going to talk to you all about Upneeq.
All right, so if you want to go ahead and unmute yours. And I got to turn on the video. Good evening, everyone. How are we? So tonight, what we're going to talk about is eyelids, and something that we do a lot of here at Revive MedSpa. You know, on a constant basis, we see patients for Botox, fillers, some skincare, but you know, a lot of the times we'll take a look and we'll be looking at someone and we say, have you, we'll look at your eyelids, and you know, patients will say, I just look tired sometimes. And if you can take a look on the right side here, you'll see this upper eyelid, and you know, it's a little low. It's kind of covering the top part. You can barely see the pupil. And then if you take a look on the left side, it looks a little higher. And what you notice is the eye looks more open. The eye looks the whole eye itself looks a little more awake, refreshed. And this is something that, you know, a fair amount of people don't realize is something that they have. And we call this, medically, it's called a drooping eyelid, is called ptosis. And that's something that can make us look tired. And there's many causes of ptosis. Some of it, patients can be born with it. Others, as we get older, it develops, but also things you don't think about are allergies, contact lens wearing. So if you really take a look here, millions of people have some form of ptosis. More common in older patients, but we do see it in younger patients. And, you know, only about 15% they say are diagnosed. And of those 15%, fewer really take treatment. But I think really the important thing is we probably all have some type of ptosis at different times. So some ptosis is something that is recurrent. Patients' eyelids are getting lower, but then there's also certain things throughout the day, contact lens wearing, allergies, long time at the computer can cause those muscles to fatigue. And we'll get times when we feel tired, our eyes look tired and are low. So it's, you know, and here, if you take a look at our ptosis little chart here, one of the things they're trying to get apart is ptosis, in my mind, really has a couple components to it. One is we have patients that come in. If you take a look all the way over on the right side of your slide where it says D, severe, you know, these patients come in complaining that their eyes feel tired when they're reading, they have a hard time. When they're trying to drive, they have to pick their eyebrows up to see better, okay? So that's a very severe type. But, you know, if you take a look all the way on the left side, A is when the eyelid, that's where typically we say, historically, the eyelid should sit, kind of right where the colored part of the eye, if you're blue-eyed or brown-eyed or hazel, and the white part of the eye meet is typically where we like to see the eyelid sit. Most people are somewhere around A to B, and then we start getting into more significant ptosis, C and D on the right. But you know, all of these can have different effects on patients. Typically, when it gets to D, it's more of a medical condition that needs maybe surgical treatment. But a lot of patients who have B and C have some ptosis going on. They don't realize it. And, you know, it's really not brought up to them. Probably on a regular basis, on a weekly basis here, we'll see patients that came in for one thing, and we'll mention to them, how do your eyes feel? Do they feel a little low? And in the past, we didn't really have a great and a lot of treatments. And now we actually have an eye drop that we can supply to you, or right for you that is non-surgical. You can use it when you want, and it can give you a great effect. It's not permanent, but it lasts throughout the day. So why don't we go on over to the next slide? This is Upneeq. It's an FDA-approved drop. We were actually part of one of the sites when this treatment trial was being performed. I was one of the doctors in the trial, and basically what patients who came in to see me for eye problems, we would put them through a protocol, and after a couple of years in the FDA approval, because of the positive effects we saw in eyelid position, the company itself got FDA approval and to treat what we call ptosis, or the drooping eyelid. Again, one of the big things is acquired ptosis. So this drop is not really for someone who might have been born with a drooping eyelid, and that's called ptosis. And basically, it lifts the eyelid quickly. Typically, you put the drop in, it'll work in about 5 to 10 minutes. A lot of the patients will notice, they'll say, oh my gosh, I feel like my upper visual field is improved. In other words, they're able to see more up top. And then also, it's in addition to what patients saying they see more, they just feel like sometimes their eyelids are lighter, but also when they take a picture, they'll feel like they don't appear as tired, and that works well. It has a great safety profile, and it's well tolerated. In fact, the patients we have on it now, we really haven't had any complaints. No. They do say some patients may feel itching or burning. We just have not experienced that. So why don't we go on to the next slide? And again, here we had that A through D little picture before, and what you can see is mild, moderate, and severe. And for this, really, if you take a look at all the different levels on the left side of your screen, up top, it looks pretty good. In the middle, someone's eyes were low, and then, on the bottom, someone who has a more severe ptosis. And, typically the middle picture and the bottom picture, people will always say, people tell me I look tired, I feel tired. I really don't, but that's their appearance. So with this drop that you can put in, it takes effect again in about 10 minutes, I would say, maybe maximal effect at 20. And it lasts for about 6 to 8 hours. And what you can see, just the difference if you look from the left side to the right side, patient looks much more awake. The eyelids are open. So symptomatically, they feel like their eyelids are open. They might be seeing more light. And then aesthetically, when people are talking to them, looking, they look much more awake on the right side. So why don't we go on here? And these are just some of the people that we've seen in our office, where you can see on the left side, you have a gentleman here. He probably has a little more drooping on the right eyelid, and then he does on his left. About 10 or 15 minutes after, you can see his eyelids are a bit larger. And then again, also with the female on the right, the same thing. What you should also notice with this drop, other drops we had before this would cause the pupil to dilate. And if you take a look on these patients, from the pupil, that's the dark center of your eye, on the top to the bottom, the pupil doesn't get dilated, or it can have minimal dilation, but not severe. So with bright light and reading, it does not affect your vision. So we can go on to the next slide. And again, here, you can see the same thing on the left side. Actually, the pictures on the left here are reversed. If you see on the bottom is the drooping eyelid, and on the top is after the drop. And then if you look on the right slide, you can see on the top is before the drop, and then after the drop on the bottom. And again, what you're seeing is the eyes more open. So if you can imagine someone looking at your face, you're going to look much more awake. That is Krista, our esthetician. So Krista, this was probably at the end of a work day, feeling tired at the end of yesterday's work day. And we had Krista, I said, you look a little tired. And we just put a drop in right at the end of the day. And just, within 10 minutes, this is up top was just finishing work. And at the bottom was, we just put a drop in, and here she does. And you can see the eye looks, much better. She's much more awake. And, when you look at the pictures, people will feel more confident. And then for others, it'll feel like their eyelids are lighter and then lifted up. And again, on the left side here, this would be Tricia, who was just talking to you earlier. Again, I think that was last night probably, but they took
Saturday.
that was Saturday after they worked. Again, she felt like her eyelids were a little low. They go ahead and put the drop in, and you can just see the brilliance and distinction. Eyes are mirror open. And again, then here on the left side is what you can kind of notice here on the, on the right side of your picture is that this is a contact lens wearer. And if you notice, the right eyelid is a little lower, but also what you can notice is the left eyebrow is higher, because when your eyelids are drooping, they're trying to lift up. So you're using the eyebrows, and the eyebrows are a little higher. When we put the Upneeq in just in the right eye, you can see that the eyelid comes up, definitely more symmetry, but also the eyebrows are kind of symmetric, more symmetric, because both eyes are open about the same. Why don't you go ahead and take this part?
So part of our demonstration today is we are having an offer on our Upneeq products. So if you wanted to come into the office and purchase a month supply is $125. Now, this is not a product that's covered by insurance. We cannot send it to your pharmacy. They actually can't make it, but Upneeq's company is actually allowing us to carry it in the office for convenience for you. So you can stop in and buy it here. Like I said, it's $125. That's for 30 days, one drop in each eye per day. The offer is that you're going to get a 5-day supply free. So you'll purchase the month supply. I'll give you another 5 days and you'll be good to go. The good thing about Upneeq is you don't have to use it every day if you don't want to. If you want to just save it for special occasions or save it for during the work week and not on the weekends, it works just as great whether you use it every day or you use it only when you need to.
Is there any question? Is there any questions from the crowd at this point?
Yeah, I think we have some. Patient wants to know, how do you know if they have ptosis? How would they self-diagnose themselves?
Well, a lot of times patients will come in after taking some self pictures. A couple of ways it can be diagnosed actually is one is if you always look at yourself and feel tired, you feel like your eyelids are interfering with your vision, that can be one symptom that you can use. When you go to see your doctor for your routine eye exam, which you should have yearly or every 2 years, that is another time that it can be identified. But also, I think sometimes patients that come in, they'll self-identify. Now, a lot of times patients will come in and say, I think my upper eyelids are heavy and I need some skin removed. And really, it's that they have a drooping eyelid. So there are a number of ways that you can use the symptoms or from friends saying, well, your eyes look tired. And then really, though, it's coming in, having the consultation, because Upneeq is made to raise the eyelid. If it's more that you may have some heavy skin on your upper eyelids or what we call hooding, then that's a different procedure. So that's one of the reasons that it is required to have a consultation to make sure that the drop is being prescribed for its intended use, but also to meet your goal and to make sure that there is not something else that's really causing the problem.
Right. So Joyce had a question. She wants to know if you can go over the side effects.
So the side effects for some was blurred vision, itching. That's really as far as we have seen and as far as the side effects. For some people who have high blood pressure, the medication is a stimulant. There was some concern that there could be a potential raise in blood pressure. We have not seen that either, but it is part of the FDA warning.
Yep. So how would they go about getting it?
So getting it would be, we'd have a consultation. We would call
Me.
Revive. That would be Tricia at the front desk or one of our front desk workers. They would set you up for a consult. We'd have you come in, take a look again, see if we make sure that this is the proper indication for it to be used. And actually, probably why we're here in the office, we instill it to see the effect.
Yeah, a lot of times we have patients come in and they're coming in for Botox or fillers, and they're just like, you know, I always look tired. And like, while we're doing the Botox, we'll put a drop in before so that they can see what it looks like before they're leaving. And it's just a significant difference. It's truly amazing.
There was a question about is there a cost for the consultation?
Yeah, so the consults are free. So all Revive consults are free. So all you need to do is call the office, which is 570-718-4800. You can talk to someone there. We can set you up. You'll come in, you'll meet with either myself or Krista, and then you'll meet with Dr. Roth, and he'll determine whether, you know, it's the best route for you, and we can get that supplied for you. You can also get to us through social media, so our Facebook or Instagram, or even sending us an email.
And the other thing about sometimes at consultations, you'll come in, you know, this is on a cosmetic side or a non-medical based side. But in our interview or taking a look at you, we may say, hey, you know what, we're going to schedule you to come back in to your medical insurance on the medical side because we want to make sure we feel that if you see something else that's medical. So it will be a consult for really lifting the eyelid on a cosmetic basis. But if we felt something was different, we then have you follow up at one of our medical spots.
Yeah. So Joyce just asked if you can still get your Botox and your fillers.
Sure.
It doesn't interfere at all.
Does not interfere with, does not have any contraindications to do it at the same time. And I think as Tricia was saying, sometimes patients will come in, we'll talk to them, and they'll say, hey, we're going to go ahead, get them set up to get their Botox or their fillers. And while they're doing that, just put a drop in. So at the end of your session, we'll take a picture just so they can see the difference.
Yeah. I think it's important for you to maybe go over the difference between if someone has a dropped lid versus a lot of extra skin that's dropping their lid, and
Sure.
why Upneeq might not be.
Well, actually, Upneeq would probably work for both. So we have different causes of drooping eyelid. Sometimes, if you think of the eyelid, it goes up and down, and there's a muscle that connects to it. And sometimes over time, that muscle, the connection can stretch, so the eyelid will rest at a lower level. And that's someone who has more of a permanent ptosis versus someone who has an irritation with contact lens or allergies, which may cause that. And then we also have patients who have a very heavy upper eyelid, or what we call hooding, and some of that weight can push down our eyelid. Upneeq will typically elevate all of those. But again, through the consultation, we may say that this is, yes, Upneeq will work, but for a more permanent solution, if that's something you're interested in, you may consider have some skin removal, and we may need to tighten that muscle. So really Upneeq, and we use that even in certain patients who say, I'm not sure if my vision is really bothered. We'll say, we'll try this. And if it does come back after you've used it for a while, then we can always talk about a more permanent solution.
Right. We're also using it for people that have to wait a little bit longer than they like to get to surgery. Busy guy over here. Does anybody else have any other questions? I think we're good. Well, thanks for joining us tonight. Thanks, Dr. Roth, for having us. You can definitely follow us on social media and our Twitter and everything to see all of our specials. And if you want to schedule an appointment, give us a call. Thanks, guys.
Good night.